The Circus Sarasota Fall is a tragic event, or in medical terms, a mass casualty. So how did the trauma unit workers at Sarasota Memorial handle several trauma alerts at once?
When 911 calls are coming in for a high-wire pyramid fall, Sarasota Memorial Hospital Trauma Center is going into war mode.
We quickly mobilized our team, got everything organized, made sure each of our rooms were set up and ready to go. And then as patients started coming in and as we started getting updates on their conditions, we were able to make a few changes and move the rooms around and the people around to make sure we had the right people in the right place at the right time.
Trauma Program Manager Jennifer Sweeney says it's a battle against the clock. The hospital staff is trying to stabilize the patient during the golden hour. That's the first hour after the injury.
So we pay attention to our clock. We like to make sure that the patients are quickly assessed and moved along to CT scan or wherever they may need to go to get them stable.
But the trauma unit's preparation doesn't start when they get a trauma alert. The hospital's chief of public safety says the staff practices mass casualty and disaster drills throughout the year.
And then when the real thing happens, it makes it so much easier to work because we've already done this.
Another thing that prepares the trauma unit is the relationship with Sarasota area first responders.
Have constant capability to communicate directly with them from the scene and with the 911 center. So we had information before they ever got here.
The 4 circus performers fell 25 feet, so the trauma unit always has to prepare for the worst.
The patients were incredibly lucky. That was a very difficult injury for sure.
Reporting in Sarasota County, Ben Bobick, SNN, the Suncoast News Network.
SMH's trauma unit has another drill coming up in the next few months to help train for mass casualty scenarios. It's the passenger aircraft disaster readiness exercise. This one will focus on an airport disaster scenario.